My name is Alicia Qualls. This is my trait care suctioning video validation number 1. Before I get started, I'm going to review my physician's order. Okay, I review my physician's orders for trait care suctioning, PRN, and I have an order for a trait care. Alright. I'm going to perform hand hygiene. I'm going to foam in before I walk in my patient's room. Hi, my name is Alicia. I'll be your student nurse today. I'm here to perform trait care on you and suctioning as well. Before I get started, can you tell me your name and date of birth? Her name is John Doe. Birthday is 12/2/2001. Okay, Miss John Doe, can I see your wristband so I can verify that? Okay, I verified name and date of birth on wristband. It is accurate. John Doe, 12/2/2001. All right. Have you had any trouble coughing or anything? Or you've been coughing? Okay. So she's been coughing. All right. So what we're gonna do is I'm gonna assess your lung sounds first. Then I'm gonna provide you with trait suctioning and trait care. Is that okay? Have you had that procedure before? She said yes. She's had that procedure before, and that's okay. So, all right. Before I get started with anything, I'm gonna go ahead and listen to your lung sounds. Is that okay? She said yeah. I have permission. All right. This will already have been wiped with alcohol. It is wiped with alcohol already. It's clean for my patient to be used on. So I'm going to go ahead and listen to my patient's lung sound. I'm going to listen to my right upper lobe, right lower lobe, right middle lobe, left upper lobe, left lower lobe. Alright, I do hear some secretions in there. I hear some congestion. So we're going to go ahead and suction you out, okay? Before I suction my patient, I don't have those supplies in here to do this, but I will verbalize. I am in a home setting, but I would oxygenate my patient. I would hyperoxygenate my patient. So I'm going to turn my oxygen dial up for my patient, all the way up, and I'm going to hyperoxygenate. Also, I would turn my suction dial on at this moment. It's going to be less than 125 millimeters of mercury, so I would turn that on. Alright, let's go ahead and get your oxygen. Okay, and another thing with this, the way this head is made, this oxygen thing does not stay on, but in the real world, you know it would be there. So we're going to lay it right there. I already performed hand hygiene, so I'm going to go ahead and get things ready to, and let me verbalize this. This will be my sterile solution. I did not receive a sterile water in my lab bag, nor did I get one in my kit that I received. So this is going to be my sterile solution. In the real world, we know that this would not be my sterile solution, but for these purposes, this is my sterile solution. It is within date. I've checked the date on it. If it were to have been used, I would unscrew the cap and I would pour a little bit out before I did use it, and I would keep it back up and use it. But if it hasn't been used, I would date it with today's date. Just want to verbalize that. Alright. So I'm going to gather my material. I'm going to check the expiration on it. All my material is within date. Nothing is expired. Everything is within date. Alright. Looks good. I do have me some tape, scissors, and an extra pair of gloves for what they're needed for. Alright. So I'm going to go ahead and get my suction catheter kit. And I will say that I did use this catheter kit to practice with a little bit. So that's why it has been open. But in the real world, it will not have been open. So let's go ahead and get that together. Once again, I've already performed hand hygiene. So that's out the way. Alright. So I want to open up my suction catheter kit. I have checked the expiration. It is within date. Okay. I'm going to get out my sterile gloves. I'm going to come here and put my sterile gloves on. Excuse my table. I am in my home setting. I do apologize. There. And excuse my sniffing, I do have a cold. Okay. I already performed hand hygiene, so I'm going to don my sterile gloves. Okay. I'm touching the inside of that glove, which I can do, because I performed hand hygiene. So I'm going to step back. And don't know. I'm still touching the inside, so I'm okay. Hands are up. Okay, so I sterile can touch sterile. So I'm going to go ahead and don my other pair of gloves. Okay. Alright. Now, this looks a mess, but I'm going to fix it. Because like I said before, sterile can touch sterile. I am sterile. In the real world, my hands will be up above my waist, of course, and this table will be up a little higher, so we'll be in a better position. So this is my dominant hand, this is my non-dominant hand. So what I'm gonna do is now I'm gonna take my get out my little suction cup. At this moment, I am still sterile. I'm just fixing this. Okay. Get my cup situated. It is still considered sterile. I'm not gonna keep that. Okay. Here above my waist. So I'm gonna take my non-dominant hand, which will become my dirty hand. I'm gonna connect to my suction canister. Okay. And I would pour my sterile solution in here to use. So I would pour my sterile solution in there. Alright. What I'm going to do is take this and I'm going to wrap it so I can have better control over it. Step back, I'm going to wrap it. What I'm going to do now is put a little bit. I'm going to put a little bit in there to make sure it's working properly, suction it up. Okay, it does suck up my sterile solution properly. It's less than 125 mils of mercury. So, okay, Jaleisha, what I'm going to do now is I'm going to go in and I'm going to suction you, okay? I'm not going to hold that because that is me suctioning, but I am going to go in without holding it, without suctioning. So, I don't want to suction going in. I'm going to go in until I feel resistance, okay? And once I'm in, I'm going to go ahead and intermittently suction. So, I'm going to go around. And I will only do this for 10 to 15 seconds. Alright. And here's some of that coming out. Alright. Got it out. Alright. So what I'm going to do now is discard of this. I will discard of this in the appropriate bin. Now that I've done that, I performed trach suctioning. We did get a good bit of secretions out. I'm gonna remove these gloves because I no longer need them anymore. Oh, I'm sorry. My hands are sweating, so they're sticking really bad. But we're going to remove these gloves. I'm going to throw this away in the appropriate bin. Okay. Perform hand hygiene. All right. Gonna don that. Throw that away. I'm sorry, in the appropriate bin. I already performed hand hygiene. So perform hand hygiene. Okay. Next, I'm gonna go in. I want to reassess my patient's lung sounds to make sure we got those secretions cleared. So this is already clean and ready to be used. Let me verbalize this too. I'm so sorry. Before I would have started that procedure, I would have put an O2 sat monitor on my patient, hooked it to my Dymo map to monitor my patient's O2 sat during that procedure. Let me verbalize that. I would have put that O2 sat on my patient to monitor my patient's oxygen level before starting the procedure. Alright. So oxygen level is still good at this moment. I cleaned it again. Right upper lobe, right lower lobe, right middle lobe, left upper lobe, left lower lobe. Alright. Lung sounds better and clear at the moment, which is great. Okay. So I'm ready to perform hand hygiene. So what I'm going to do now is get my trach care kit. Okay. That will be discarded in the appropriate bin at this moment. I do have my tracheostomy care tray. I'm going to open that carefully. I've already performed hand hygiene. I'm going to open that carefully. I will not open it all the way because I may have to use it again. So I'm going to do it like that. I'm going to look for my 1-inch border. Okay. I'm going to grab it using my 1-inch border. My 1-inch border. I do have a shiny side and a dull side. So this is my shiny side here. I'm going to place it down and maintain sterility while doing it. Okay. Which we did good. Alright. Next I'm just going to take my material and step back. I'm just going to drop it down, step back. I'm gonna come around my sterile field and discard that in the appropriate bin. And we do know that if it had any body fluids on it or anything, we will discard that in the red bin. So I want to realize that. So now I'm going to don my sterile gloves. I've already performed hand hygiene, so that is out the way. Okay. Alright. I'm gonna don another pair of sterile gloves at this moment, because this is sterile procedure. Still checking on my patient. Are you okay? You're not in any respiratory distress or anything? Patient states no respiratory distress at this moment. Right. Okay, I'm gonna go ahead and perform trach care on you at this moment. I don my sterile gloves. I'm touching the inside of these gloves, which is okay. I have not turned my back on my sterile field. I still have my sterile field in view. So my back is like kind of turned that way to the side. Okay, so I'm going to take my sterile hand and don my sterile gloves again on my other hand. Okay. And in this moment, sterile can't touch sterile. So I'm going to fix my gloves. And they are on completely backwards. But that's okay. We're going to fix that here. My sterile field is still in view. Patient is not in any respiratory distress, so we're good. Okay. I'm still sterile because sterile can touch sterile. My hands are sweating, so it's making it a little more difficult. But I'm going to continue to fix my gloves because, like I said, sterile can touch sterile. They're on, they're fixed, they're ready. Hands are both my ways. Have my sterile field in view. Okay. Let me realize I would not have put my tray right there. I'm going to scoop my tray right here. I am still sterile. That tray, inside that tray is sterile, so I'm still okay. And I do have some sterile solution inside that tray. So what I'm going to do is now take my sterile cup here. I'm going to place it right here because it was still inside of my sterile solution, my sterile field. So I will put some solution inside of here. I don't have it. I have that, but it's not what I need because I didn't put it in my bag. But I would put some sterile solution in here, and it is sterile solution in there as well. Okay. So what I'm gonna do now is come over here to my patient. This is my dominant hand, non-dominant hand. This will be my clean hand. This is my dirty hand. What I'm going to do is take my patient's plug out. Alright. I'm going to come around my sterile field, put it inside of my solution. Okay. This is my dirty hand, this is still my clean hand. I'm going to take my brush here. This is, getting stuck to my gauze. It's okay. I'm still sterile in that hand. So it's okay. Okay. Alright. This is my dirty solution. This is my clean solution there. What I'm going to do is take it with this hand, pick it up, and I'm going to clean it. I'm coming around my sterile field. I'm going to clean it. Coming around my sterile field. Careful not to get over my sterile field. Just going to clean it real good. Get any of that dried secretions that was in there out. I'm going to discard of that in the appropriate bin. I'm coming around here. So I'm looking at my stuff, and I only had two of these Q-tips. I know you're supposed to have more, so I'm just gonna go ahead and clean that out. I'm drying it out. I apologize. I'm gonna dry that out. Dry it out. It's dry. I'm gonna squat that in the appropriate bin. Come back around. It is dry. I've dried it out, so I'm gonna discard it in the appropriate bin. Now I'm going to place that back. Okay, I'm going to reach over my sterile field. Alright. Now, my glasses are falling. I apologize. Now what I'm going to do is go ahead and clean around my trach. So I'm going to take this. I'm going to put this in the clean water. Come around. I'm going to remove my dressing. Okay, I'm going to assess my dressing for any drainage or secretions and stuff. So, I will come around, discard that in the appropriate bin. I'm going to clean around my stoma to get any dried up secretions off of there, any dirty secretions. Okay, on both sides. Come around, discard that. Can get another one. Put it in my sterile water, clean water. Come around. Gonna clean up top, around my stoma. Careful not to reach over my sterile field. Come around my sterile field. Discard that in the appropriate bin. Okay. Now what I'm going to do is go ahead. This is my dirty hand. This is my clean hand. I'm going to go ahead and get this gauze. I'm going to put it in the clean water. Come around. I'm going to clean around my stomach again to get any excess secretions off of my trach to opening. Clean on all sides. Alright. come around my steel field. Gonna discard in the appropriate bin. Okay. I would put that in this hand, cleaned it with this hand, and then discard it. This hand will still be dirty, this hand will still be clean. I'm gonna just get it and dry it. That's what I would have done the first time. I do apologize. We'll dry it really good. Come around and discard it. I would have put that in this hand. Let me verbalize that. Okay, this is still my clean hand. I'm gonna get it. So I can go ahead and put my patients. I can't do that with one hand. Let me verbalize that with this mannequin. I'm gonna go ahead and replace my dressing. I did dry it before I put that back on there. So it is dry. I'm careful not to leave it wet because I don't want any skin breakdown around that stoma. But I did dry it. Okay. Right. I have that. Next, I don't need my sterile field anymore because the patient's stoma has been cleaned, dried, and dressing has been replaced. So I'm gonna remove my gloves. I would throw that away in the appropriate bin. So I'm gonna perform hand hygiene. I'm gonna put on my regular gloves. Okay. And if you hear background noises, let me apologize. I do have a 3-year-old child. And that's the only thing that'll keep him quiet for me to do this. So I perform hand hygiene. I put on some clean gloves. I'm gonna take my scissors now. And I'm going to cut this at an angle to wrap around. I'm going to cut this at an angle to perform. Put it around my trach. I did see in the instructions video that she cut her old one at the end. I'm gonna go ahead and cut my old one now because I don't want to not know which is which. So I'm gonna do that now. Going to, oh my goodness, that would not happen. I see why she didn't cut it now, but I'm gonna hold that in place. Alright, Jaleisha. I'm just making sure I got all this stuff together. Alright. Now I'm just going to tie this in here. Alright. It's hard to tie this on here with these gloves on because my hands are sweating so bad. So I'm going to use these scissors to help me get that through there. I would not do this in the real world. Right. Okay. Once I have it in there, I'm going to make sure they are both the same length. And they are. Let me go around here now. I'm gonna make sure they have the same length. Alright. And they are. I'm gonna come around my patient toward the back. And I'm going to do the same on this side. There. Alright, I have it. What I'm gonna do here is just tie it up. Right. And I will be sure to double knot it. Okay, it is double knotted. I'm gonna cut my excess off. I don't need it. Okay. Now I'm going to remove my old one. I see now why she would have waited to remove her old one. But now I'm going to remove my old one. That one right there. I'm going to discard that in a appropriate bin. Alright. I will assess my patient. No signs of respiratory distress. My patient isn't in any type of distress. Anything like that. So now I'm going to go ahead and turn my patient's oxygen dial back down to the oxygen level that was ordered for that patient. I'm going to go ahead. I've already turned my suction catheter off. I'm going to remove my gloves. I'm going to dispose of my gloves in the appropriate bin. If I have body fluids on my hand, on my gloves, I would put them in the red bin. I'm going to go ahead. I will remove my trash and place my trash in the appropriate bin. Gather my supplies and my trash. I'm not going to throw anything away because I might need it again for a critical. But I'm just going to go ahead and dispose of that. I perform hand hygiene. I lowered my patient's oxygen level back down. Oxygen therapy back down to the ordered oxygen level. Oxygen supply. My bed is in lowest position. My patient is comfortable. No signs of distress. How did you feel about the procedure, Miss John Doe? She said she did well. She didn't have any signs and symptoms of distress. No trouble breathing. Well, that's great. So what we're going to do now, I would have placed that back on my patient. My patient's trach, I will place it back on. Bed is in lowest position. Call light is in reach. Call bills is within reach. Personal belongings are within reach. I will assess my patient. Patient is comfortable. No signs of distress. I will perform hair hygiene. And let me verbalize this. I don't know if I verbalized this, but let me verbalize it again just in case. Before starting all of these procedures, I will provide my patient with privacy. Verbalize that. I'm not sure if I said that. I will perform hair hygiene and go document appropriately. accordingly. Let's see.